Good morning, everyone, and thank you all so much for being here today. I am Councilwoman Felicia Porter, representing the 10th District and Chairperson of the Public Health and Environment Committee. Also joining us today, we have Councilman James Torrance, I saw him around, and then we also have Councilman Mark Parker from the 1st District. We also have members of the City Council President's Office and also members of the Mayor's Office today, and our committee staff person is Marguerite Curran. Today, we are discussing 3 resolutions as a result, not as results, but as a honor for World AIDS Day in the month of December. And so we are taking an opportunity to revisit our well-being series, particularly for gay, bisexual, and transgendered people in the city of Baltimore. So the first resolution we are discussing is Council Resolution 25-0020R for the purpose of inviting the Mayor's Office, the Baltimore City Health Department, the Baltimore Police Department, Baltimore City Public School System, the Mayor's Office of Homeless Services, the Mayor's Office of Employment Development, and the Mayor's Office of LGBTQ Affairs and the Baltimore City Office of Equity and Civil Rights, here to discuss the general well-being of gay men in Baltimore and to provide an update to the council thereof. Now, each year, on December 1st, our city joins communities around the world to honor World AIDS Day, a remembrance, a day of resolve, and a day when we speak aloud the names and memories of loved ones taken far too soon by AIDS and HIV. We remember their parents, siblings, partners, neighbors, activists, and entire generations of promise. Baltimore's story is shaped by their language and their courage, their resilience and their fight, and our work today in many ways is a continuation of their legacy. What remains is what we need is political will, We continuously need political will and the moral clarity to close the gaps. Today, we are centering the well-being of LGBTQ+ Baltimoreans not as a side conversation, but as a core responsibility of city government. LGBTQ residents deserve a city where they feel safe in their bodies, affirmed in their identities, protected in their homes, and respected in their workplaces, and valued as full participants of civic life. This means strengthening HIV prevention and treatment efforts, but it also means ensuring that Baltimore's LGBTQ community has access to culturally competent care, city services, and also community-based support systems and environments free from violence and discrimination. Today, I want us to move more with intention. I want us to ask the hard questions. I want us to hear directly from LGBTQ residents, advocates, providers, and community leaders about both the barriers and the solutions. I want us to leave this chamber committed not just to another report and not just to symbolic gestures, but to action that improves our lives. And in recognition of World AIDS Day, let us recommit ourselves to compassion, health equity, and community, to the unwavering belief that Baltimore can and must be a place where every person is able to live, love, thrive, and be well. Thank you. All right. I am going to go to public testimony first. For all that this is your first time coming to the chamber for Public Health and Environment Committee, we do things a little bit differently here. We have public testimony first. It is an opportunity for agencies to hear from public about what's happening in community, and also for you all not to have to sit through city agency presentations and then speak your mind. We really follow a community-centered approach. So the first one I'm gonna call up is Tamar Wilson, Traymore Wilson. I'm gonna call you up. You have 2 minutes, sir. And if you could press the button, there we are. And for the record, if you can say your name, sir.
Awesome. Let me first start by introducing myself. My name is Traymore Wilson. I am the Chief Director of Special Projects for the Pride Center of Maryland, have been sitting in that role or similar roles for the last 5 years. And I'm here today specifically about this topic and topics involving members of the LGBTQ, same gender loving community at whole. This issue here is really important because we have seen a huge divide, a divide coming from the federal government, a complete attack towards this community at large. This community continues to suffer some of the most dispersed treatments among people in general, talking from substance use rates, talking from overdose, suicide ideations and suicide rates in general, and just lack of proper health care, lack of housing issues in general. One of the things that we have been doing at the Pride Center of Maryland has been intentionally attempting to do surveys, intentionally to survey the community to understand what the needs are. We have identified 4 core components for it. One has been housing. The city and other resources identifying and actually putting physical resources between the housing for members of the LGBTQ community. Another one we have shown is actual cultural competency care in general. A lot of the care from doctors and physicians and hospitals has not been cultural competent and has left people untreated and uncared for many years. And then to end on my second note, the 2 second notes is a level of continuing care illustration, realizing that a lot of members in this community continue to go to organizations and become hurt, become not supported, become turned away and discriminated against. So even organizations in the LGBTQ community. So as the Pride Center of Maryland, we come here today to ask members of the city, other agencies to really dedicate their time to both looking into these agencies and ensuring that they're providing the care for the communities that they say they serve, and also just ensuring that this community is well-being. Thank you.
Thank you so much. We did not have anybody else that signed up for testimony. Is there anybody, before we move on to agency presentations, is there anyone else that would like to testify this morning? All right, hearing and seeing none, Dr. Taylor, I'll turn it over to you.
Good morning, Chair Porter and members of the committee. Thank you for once again raising these important topics. As we shared last time, the Baltimore City Health Department serves all Baltimoreans, regardless of gender, race, religion, or sexual orientation. We strive to provide a welcoming, stigma-free environment and to provide high-quality services to all. When these hearings were held over the summer, the Baltimore City Health Department shared an overview of our programs and services that focus on HIV and sexually transmitted infections. This was partly because gay men and transgender individuals are disproportionately impacted by these conditions. This time, the sponsor has asked that we share follow-up information on some topics that were of particular interest to the committee. Before we jump in, we want to recognize that the health and well-being of gay men and transgender individuals goes well beyond HIV and sexually transmitted infections. Issues ranging from housing, chronic disease, primary health care, mental health, and violence prevention, just to name a few, are vital to the overall well-being of LGBTQ individuals. Additionally, and very importantly, anyone can be affected by HIV and STIs. This is very important to name because it can be stigmatizing to focus on just these issues as it pertains to the health of LGBTQ individuals and misleading to think that HIV and STIs only impact specific groups. I also want to note that issues pertaining to the health and well-being of gay, lesbian, and transgender individuals are separate, unique, and nuanced. Now I'll dive into sharing those updates. At the previous hearing, we shared data about HIV rates from 2023. Several weeks ago, the 2024 data were finalized, so we can share those with you today. In 2024, there were 179 people newly diagnosed with HIV. About 5% of those individuals identified as either a transgender man or woman. This is similar to the data from 2023, when 6% of newly diagnosed HIV individuals identified as gender diverse. This is likely an underestimate, but has been consistent the last 2 years. 57% of those newly infected with HIV in 2024 were men who report male sexual contact. This is down slightly from 2023, when 62% were men who reported having sexual contact with men. This is a shift from earlier in the HIV epidemic, when injection drug use was the most common exposure. Given lower risk to exposure, when data are collected and reported for HIV, HIV diagnoses among women are not categorized by sexual orientation. Around 20% of people newly diagnosed with HIV are women, which has been relatively stable for the past 4 years. Now I'll shift to sharing some updates about syphilis. Almost 70% of syphilis infections each year are among men. Among men with syphilis, 40% report sex with men. We saw syphilis numbers increase from 2022 to 2023, then decrease some in 2024. Specifically, we saw a decrease from around 1,200 cases in 2023 to 1,110 in 2024. We are closely monitoring the data for 2025. We continue to test for and treat syphilis in our clinics and conduct testing for syphilis on our mobile outreach testing van. We also reach out to all people with infectious syphilis to ensure they are aware of and understand their diagnosis, have received treatment or assist with linkage to treatment, and conduct confidential partner notification. We are also actively engaging healthcare providers and community partners. For example, we've sent an advisory letter to healthcare providers informing them of high levels of syphilis in the community, reminding them to follow guidelines regarding syphilis testing, and encouraging them to have a low threshold to test for syphilis. We've also launched a new provider website with information on diagnosing syphilis on the Be More for Healthy Babies website. Although not directly related to this hearing per se, we've also onboarded a community health engagement specialist specifically to reduce cases of congenital syphilis. Over the summer, when there was a nationwide shortage of the main medication used to treat syphilis, we coordinated with local hospitals and other providers to ensure awareness about federal guidance around syphilis treatment. Currently, we are partnering with the Regional Prevention Training Center to increase education and awareness to providers about diagnosis and treatment, which we hope will help overcome any implicit bias or discomfort providers may have about talking about sexual health. We've also been raising awareness about high levels of syphilis with several community groups, including groups associated with the Health Department and the Mayor's Office of LGBTQ Affairs. We are continuing to expand our programming around syphilis and anticipate additional programming in the coming months. Last but not least, I'll touch on Mpox, which you may have heard referred to as monkeypox. Mpox is an infection that is caused by the monkeypox virus. There was an outbreak in the United States in 2022, and Mpox has been circulating in low numbers in the U.S. since then. Mpox can cause a painful rash and is usually spread by close contact, including sexual contact or contact with bodily fluids. Recently, we have seen an increase in Mpox cases. In Baltimore City, we saw a total of 24 cases reported from January 1st to November 20th, with more than half occurring since September 1st. This is in comparison to 4 cases in 2023 and 7 in 2024. This increase has also been seen in other cities, including New York and DC. Although Mpox can infect anyone who's exposed, those at highest risk include people with multiple sexual partners, men who have sex with men, and transgender people. We are regularly screening patients for their willingness to receive Mpox vaccine in our clinics, and we're currently offering Mpox vaccine at our clinics at East Fayette Street and Saratoga Street. The vaccine is also available on the commercial market, although patients may need to call ahead to pharmacies to see if they are able to get vaccine, as not all pharmacies are stocking or ordering it. To ensure that the public is aware of this increase and taking steps to protect themselves and others, we've put out a press release. We've also sent a provider letter informing clinicians around the city about this increase and encouraging them to encourage patients at highest risk to get vaccinated and test for Mpox when appropriate. We're also working closely with the Mayor's Office of LGBTQ Affairs. We met with the new director, Dr. Bryant, over the summer to provide an orientation to BCHD's HIV and STI services and programs. We have participated in the office's meetings with community organizations to provide awareness about the levels of syphilis and mpox, and recently co-hosted a community event to raise awareness and reduce stigma around syphilis. Thank you for your attention.
Thank you so much, Dr. Taylor. Committee members, before we go into that, just want to recognize Councilwoman Ramos and Councilman Conway. Thank you for being here today. Thank you, ma'am. All right. Before we go into questions, committee members, this is just a reminder that you have 2 questions to ask the health department. Let's make them short and concise. I want to be respectful of Dr. Taylor's time here today, and she has to leave. So we want to be respectful of our health commissioner's time. All right, the first question that I have, Dr. Taylor, and this is something that I've really been focused on, particularly in I'd say like the last 6 months, is really the connection and the coordination of services between our health department and various groups throughout the city. And so for the topic of this conversation, the LGBTQ community, we see that there is disjointed care. Not just within housing, but also primary care, behavioral health, and also other social determinants of health. How are you all working with the LGBTQ Affairs Office to spearhead the consensus of those services for residents?
Thank you for that question, Madam Chair. So, like I shared, our office has been working very closely with Dr. Bryant's office. As you know, Dr. Bryant and I are both fairly new, 4 months in, and so we have been doing a lot of meetings to coordinate efforts, to educate her staff about services, and a lot of her staff already know what services we provide. Like I was describing in my presentation, a lot of this care is very nuanced, right? It is not a monolithic population, and I think a lot of times because we say LGBTQIA+, we're thinking that everybody's care is the same, and it's not. Some people just in that population in particular just want primary care, but they don't necessarily always have primary care providers who are comfortable with providing that care or who have received the competency training that they need. I really appreciated the public comment before because it's true. A lot of times you have people in this population who just want to be seen for regular healthcare things. But as soon as they present and they say that they are a part of the LGBTQIA+ family, then the provider immediately wants hands off because they say, well, I don't provide gender affirming care, or I don't provide, mpox vaccine, or whatever they say they don't provide. And so it's really important for us to work as agencies together to say what services they are and to really coordinate in community events so people feel comfortable coming in.
Will there be a report published related to these meetings and the outcomes of those meetings and I'm looking squarely for the LGBTQ Commission. That may be something where we kind of use that commission as a way for a community action board once we kind of get the preliminary meetings going between the 2 directors to push it out into community.
Well, I won't speak for Dr. Bryant, but we would be totally supportive of something like that.
Okay, thank you. Any other questions, colleagues? No? All right, thank you so much.
Thank you.
Next, we're going to move on to 25-0021R for the purpose of inviting representatives of the Mayor's Office, the Baltimore City Health Department, the Mayor's Office of LGBTQ Affairs of Baltimore City, the Office of Equity and Civil Rights, and also the Baltimore City, the Mayor's Office of Homeless Services, here to provide an update on the well-being of LGBTQ residents in Baltimore City. I'm going to provide an opportunity for the new Commissioner for LGBTQ Affairs, Dr. Melanie Bryant, to start her presentation.
Good morning, Madam Chair, and to the other members of the committee. I am Dr. Melanie Bryant, and I am the fairly new appointed director for the Mayor's Office of LGBTQ Affairs. It's certainly a privilege to be here. One of the things that we came in to start was to really hear from the community. I did not want to do another town hall meeting because the community and the people who work and are centered in the work of the LGBT community already know what is happening. And we turned our attention directly to our community partners to hear from them what the needs are of the LGBT community. And so we do have a few slides prepared for the committee. I will begin to read some of the information and it will queue up when it needs to. Some of our goals and some of the ones that I will speak to today is to expand LGBTQ plus equity and inclusiveness training across all city agencies, to strengthen partnerships and community engagement with LGBTQ plus serving organizations, to advance LGBTQ plus equity and accessibility across city offices, of course, track public engagement and communications. We've been asked to serve as a pilot in partnership with the Baltimore Health Department for Charm Care to provide resources and access to those resources online using GIS mapping. And then also we support the work of the City LGBTQ Plus Commission, along with our state and local counterparts, the Mayor's Office of Government Relations, for policy recommendations to support the LGBTQ Plus community. As it pertains to equity and inclusiveness training, we began to look at the training modules that are offered at the Baltimore Police Department and that are also offered across other city agencies.
And I'm sorry
yes.
to interrupt, Dr. Bryant. Are
Yes.
you moving along with the slides?
I am. I'm sorry.
Okay.
I'm on slide 2.
No worries. And for Marguerite, if you can just say next slide.
Next slide. Yes, absolutely. Thank you. Next slide. Okay. And so to date, we have 1,117 total city employees trained using the Workday training. We've also expanded to work with other agencies. Some of them are listed, 15 city agencies that have taken this training. And the training is, as Trey Moore spoke about, this piece of cultural competency, understanding the nuances of the community, understanding pronouns and usage and all of those pieces. And so we're looking to expand those trainings as city agencies ask us to be a part, to come to do those trainings. We certainly do that. So that includes 15 city agencies, 17 mayoral offices, and 8 quasi-agencies. And so we will continue to do that training across the city. Next slide, please. We were also looking at the implementation of gender-neutral restrooms throughout the city in accordance with city code. And so to date, there have been 9 completed conversions, 4 in the police department headquarters, 3 in the Northern Community Action Center, 1 in the Abel Woolman Building, and 1 in the Baltimore City District Courts. And so we are continuing to work with DGS to see that in every city agency there are access to gender-neutral bathrooms. Next slide, please. Out of the centering the needs of the community, we began to have liaison group meetings with city agencies. And out of that came a need for LGBTQ plus employees, city employees, to have a space to convene, have a space to address their concerns. And so we began an employee resource group, and we had our first meeting in November, again, to meet the needs of city employees who identify as LGBTQ plus, and that is moving forward, and we're excited about the partnerships that can come out of that work. Next slide, please. As it pertains to strengthening partnerships and community engagement, again, coming into the position, it was important to me to center the needs of the community, hearing directly from community members, hearing directly from community organizations who are doing the work. And from those, these 3 things came into existence. So the first is community conversations. And this is where we team up with a community organization and they tell us what the needs are of the communities that they serve from their perspective. And we meet them with city resources. We meet them with a hot meal. And so we're able to go into different areas of Baltimore to be able to meet the needs. And so far we have partnered with the health department in November to host a meeting with Baltimore Safe Haven to talk about the rising rates of syphilis. In October, we screened a a showing of Intentionally Erased, which is about the violence, intimate partner violence in the trans community. And so the Community Conversation series is one that we do on a monthly basis. Our next one will be with the Pride Center of Maryland. Again, for us to begin to hear directly from the community members, to meet directly with constituents, to bring the resources and the access directly into the community. Our community sync meetings is another way that, again, we connect with the LGBTQ plus community. And this is for our community partners who are doing the work in the LGBTQ plus space. And we meet with them on a monthly basis. And so we have representatives from community organizations, from businesses, from the state chambers that come to talk to us to help us understand what is happening in the LGBT community and how we can support the work that is already being done by those partners in the community. Another thing that came from again, our centering the needs of the community is interagency liaison meetings. And we have a liaison from, at this point, almost 20 agencies across the city, including quasi-agencies, and they meet monthly with us as well, so that we can hear the needs of all of those agencies as it pertains to serving the LGBTQ plus community. One of the things that we heard in one of those meetings is the need for us to look at legal resources for people who have transitioned and have property in their dead names, and the need for us to be able to address some of those issues to help people switch the names on their deeds so that when death happens, there's no issues in terms of that particular process when it comes to housing and assets that are left behind. And so these are the needs that we are strengthening partnerships. These are the ways we're strengthening partnerships and involving and engaging with the community on a regular basis. Next slide, please. Again, as I talked about some of our events, we hosted a Let's Talk About Sex event, which centered the needs of the BIPOC lesbian community, looking at sexual health and sexual wellness in that particular community, and that was held in October. And I also spoke about the Community Conversation series that is listed here. Again, that screening in partnership with Free State Justice and in collaboration with the Mayor's Office of Neighborhood Safety and Engagement and their Intimate Partner Violence Prevention Program. That screening of Intentionally Erased talks about the violence in the Black trans women community in particular, and being able to have a panel discussion with community members about how we can do things to address the needs of that community. Again, I spoke about the sexual wellness event hosted with Baltimore Safe Haven in collaboration with the Health Department and R&D Associates, talking about the rise of syphilis in the LGBTQ plus community. And then we'll be hosting in December an event with the Pride Center of Maryland, talking about, and ViiV Healthcare, talking about a pleasure-based approach to HIV prevention. And so again, we are attempting to meet the needs of the community by partnering with organizations and agencies who are already doing the work and have been historically doing the work in the community to meet the needs of the community directly. Next slide, please. And then finally, we are working, and that slide has been updated, to support the LGBTQ plus commission, and they are the advisors to the mayor, to city council, and city agencies about the issues of concern that affect the LGBTQ plus community. And so we meet with the commission on a monthly basis to address these concerns, to partner with the LGBTQ plus community, and one of their current goals or current initiatives and priorities is to address some of the needs of the LGBTQ plus youth population. And so that is the work that we do. Next slide, I believe that's the end. That is our social media and the ways that we can be contacted. But again, thank you for this opportunity to share, and I'm grateful to be able to join with the LGBTQ plus community and other organizations as we do the work to meet the needs of the LGBTQ plus community.
Thank you so much, Dr. Bryant. Committee members, I'll start with you all. Do you all have any questions? Okay. Councilwoman Ramos.
Thank you, Madam Chair. Welcome, Dr. Bryant, and Director, and you've already hit the ground running. We also met outside City Hall helping somebody, so I appreciate your help there, and I know you and I learned a lot on
Yes.
that one. What you touched very briefly on some of the challenges that you're trying to address and that the commission's trying to address relative to housing. Can you talk a little bit more about I think I know the answer, but I want to be able to, have more of a discussion about it at some point relative to not just the need for affordable housing, stable housing, but also this issue of, what you had just talked about with the deeds, but, what specifically you're seeing and what the commission is seeing relative to the needs for housing in the community.
Is specifically as it pertains to homelessness. That is an issue that we continue to see. And again, in conversations with the commission, looking at how we can support the commission as they look at policy advances to how we can provide for the LGBT plus community as it pertains to houselessness or homelessness. That is a very much an issue of concern that we will continue to look at and that we will continue to address. Again, one of the things that we are attempting to do in our community conversation series is bring the resources to the community. And so looking forward into 2026, we are looking forward to addressing some of those issues in community to be able to hear what the issues are and then move forward with the commission and move forward with our state counterparts to look at how policy can go to support those issues and meet those needs.
I mean, I think that there's a lot of people dealing with the same type of issues that I think everybody else is having relative to affordability and on all of that. So I think that, we certainly want to be a part of that conversation.
Absolutely.
As well. And then I guess we're going to hear from MOHS, so I'll wait for that conversation. Thanks, Madam Chair.
Thank you so much. Any other questions? Councilman Torrance?
Thank you, Dr. Bryant. So I have a general question. Have we worked with our hospital partners for a lot of their primary care to have their doctor self-identify as being competent? That way, as if I'm looking up for a doctor through my healthcare insurance, I can look to see someone who's appropriate for me as a Black man. But what if I want to go even deeper and talk about my gender identity? And so probably working somehow with getting our partners to have their staff self-identify as willingness, because we go places, we see the Safe Haven sticker in windows, but how can we publicly say, I'm a person that will be here for your gender affirming care, or I understand and self-identify? Because I think that's the easiest way for people to navigate. And then once people start seeing that there's a market, that people feel comfortable to come to that person, then people start being comfortable with it even more.
Absolutely. One of the components of Charm Care, which is what we've been in conversation about with the health department, is a website that allows us to bring all of those resources into one place. And the conversations that we talked about was for exactly that reason, not just for healthcare, but for other things as well. Places where we can identify using GIS software, this is where the community can come to access mental health care, to access primary health care, to access a cup of coffee, because we realize that there are, in this particular time, people feel unsafe. And so getting that project off the ground and looking forward to moving that forward will absolutely be able to address some of that, for somebody to say, hey, I know where I can go to see where I can be seen in those spaces. And so we look forward to continued partnership with the health department to try to get that resource available for the LGBTQ plus community.
I appreciate that. And I just want to say I'm thankful for the conversations that we've had. I've been exploring the idea because I now have a large portion of the Charles Street corridor. In finding ways for persons who are looking for gender-affirming care, who are entering into sex work, to have transitional income and to have access to health care through transitional income so that they don't have to do sex work. And I'm thankful for you providing the ideas around that, because for me, I recognize as someone who was formerly homeless myself with my family, that we have to meet people where they need us to, and not where people with privilege need to tell them they need to come to. And I think I'm just thankful for your willingness and your openness to actually look into those ideas.
Thank you.
Thank you so much. Colleagues, any other questions before I go into my questions? Councilman Parker?
Thank you very much. I really appreciate the opportunity to speak with you all today and for the good work that you all are doing. The USDA announced yesterday that's really a sensitive microphone. USDA announced yesterday that it was going to threaten to withhold federal funding for states relative to SNAP benefits to states that don't comply with questionable demands to provide personal information of food assistance recipients, acknowledging that we already heard today from our public testimony as well as kind of our general work in this area, that our LGBTQIA plus neighbors already face significant barriers to accessing public benefits like nutrition and healthcare. Do we have some sense of I know most of the focus has been on immigration, but do we have some sense of how the invasiveness of this demand may be impacting the communities that we're talking about today?
Not at this moment, but that is certainly something that we will look into and connect with our partners and connect with the commission to get that information and begin to develop a plan of how we can connect people to food sources, connect people to food banks, connect people to resources to be able to provide for themselves and for their families.
Thank you so much. Mr. Schnell, I want to go back to slide 3. Well, she can't bring it up right now. When we're talking about the training, how many city employees do we have on the roster now?
I don't have that number in
But
front of me.
it's well over the 1,100, correct?
Oh, yeah, absolutely.
So my question to you is, why aren't all city employees trained?
So I would need to look into that unless Dr. Bryant knows. I don't know if that training is mandatory, or if it's on workday as like an optional training
Sure.
module that an employee can take.
Sure. Is there a opportunity for it to become mandatory?
We can certainly have a conversation with the city administrator in DHR if that's something you'd be interested in.
Yeah, and
Okay.
so I would like to make that, and Marguerite is talking with people now, but I would like to make that an official city request. A committee request, excuse me. I really think that training should be mandatory. I think that, that's an opportunity for the director. I would love your leadership there because in a sense where we have, I believe this CA mentioned about 3,500 city employees. That's 1/3 of our population here in the city of Baltimore that are currently trained now. And so I would love to see this training become mandatory given the climate that we're in now. Thank you so much. And you got that, ma'am? So no worries. This is an official committee request for mandatory training for slide 3. Thank you. All right, and Mr. Schnell, my next question, who is the council liaison for the LGBTQ Commission?
I'm not sure if one has been identified yet.
Is there an opportunity for someone to be identified?
Yes. Yeah.
Okay, and so that's an official city committee request for the council president's office. I don't see any of his staff here. Okay, Mr. Schnell, if you can just make that a note. I would like a council liaison, or at least a council staffer on the commission at all meetings, please. The reason why I want to do that is because, again, when we're talking about that connection between the commission and the council, we need to make sure that we are coordinating services, but also any type of city legislative ideas. We are fully fully participating in the conversation to elevate the conversation. The next question that I have, and this is something that may be for the director of the commission or the director of the LGBTQ Affairs Office. What are the current needs of the community preliminarily? You mentioned that you had community conversations. What were some of the needs that were shared during the first or even couple community conversations?
So again, when we partnered with Free State Justice to show the film Intentionally Erased, the violence towards trans women is certainly a concern, especially in that intimate partner violence space. And so highlighting those issues and highlighting those concerns and hearing the voices of people who have been impacted is certainly a concern that we are continuing to be a part of conversations with and continuing to see how we can meet those needs. One of the things that came from that is a connection to Morgan State University and going to college campuses to address and just educate in terms of trans health and trans wellness. That is a issue that we're looking at. Again, the piece about syphilis and looking at how syphilis rates are rising, particularly in the LGBTQ plus community. That is certainly one that is on the table as well. HIV prevention is one that is always on the table as well. And then looking again with the commission, looking at youth, the LGBTQ plus youth, looking at employment in the trans community is one. So all of these issues, again, because we serve so many populations and we're not a monolith, being able to look at all of the needs all at once is something that we're always continuing to do. But those are specific needs that we are looking at and we have been looking at in this season as we prepare to meet the needs of the community.
And let me ask this, Dr. Bryant, are you prepared to develop a report to the city council? What's gonna be the external stakeholder engagement after these community conversations?
Well, we do promote information. We put it on our website, but we will be doing a yearly report that will allow us to provide to constituents and to council as well the updates of what we've been doing and the work that has been shared with community and information that's been shared with us as well.
Will one be produced this year?
Yes,
Okay. And so by December 31st, the city council will be presented with a report?
we will try to do that. Yes, ma'am.
yes.
Thank you.
No worries. All right, Ms. Nestella, if we can, okay. The reason why I want to frame that, because as we approach next year, many of the members of this body are very active in Annapolis. And so there is an opportunity for cross-collaboration and cross-pollination of not only in this chamber, but also at the state of Maryland as well. Councilwoman Ramos mentioned housing, Councilman Conway, public safety, myself as the chair, Councilman Torrance as housing, and also just legal matters as well. And lastly, Councilman Parker really focusing on the immigrant community. We have such a vast majority of expertise within this body. We really need to make sure that we are collaborating and coordinating and not forgetting you all in the conversation of public health and also the environment as well.
Absolutely.
Thank you. Councilman Torrance?
I just want to make sure we are in lockstep with the Carlton Smith Act to make sure that we've updated our policies at the health department, as well as discuss with the clinics and persons that we have authority over through the health department, that they're in lockstep and key about the Carlton Smith Act so that they're not reporting people for transmission. So we're not criminalizing people, because I know that it just passed, and I think it was October 1st is when the law went into effect. So I just want to make sure that we are remaining in lockstep, that it took a while to get the act passed, to make sure that we're not criminalizing people for HIV transmission. I just want to make sure that some of our providers know that this thing doesn't exist anymore, because I'm always afraid that they didn't know and they still make a phone call and then our police department doesn't know. Just want to make sure.
Madam Chair, can I defer to our commission chair for a few comments?
And is that in response to the question? Okay, thank you.
Yeah, I was like, I can add a little bit of context, actually, not just to that question, but to a few of the other questions.
If you could just answer that question, and then I'm actually going to go to you as my last person.
Okay, great.
Thank you so much.
Yeah, my goodness. What was the last question?
So I believe, Councilman Torrance, if you can reiterate your
I just want to make
question.
sure that we're in lockstep with the implementation of the Carlton Smith Act. I just want to, not only from our health department, but also to those we oversee that have clinics in Baltimore City too.
But yeah, that's just a concern of the commission.
Yeah, I was gonna say, that's not really let me look into that. Since to your point, the law did just go into effect. I'll circle back with the health department and then we'll get a response to you, unless you have a response.
If you could speak into the microphone, please.
Sorry, the
Thank you.
microphone's a little tall.
No worries.
Invite our leadership to speak to that. Thank you.
Thank you. My name is Dr. Adina Greenbaum. I'm the Assistant Commissioner for Clinical Services and HIV and STI Prevention at Baltimore City Health Department. So yes, we're aware of the act and follow reporting and encourage reporting across the city in line with federal and state guidance.
Thank you. My next question has to do with the specifics of the LGBTQ Commission. And so, Chair, I would love if you can just provide an overview of the commission, some of the things that you all are working on, and how we specifically, the council, can address the needs that you all have in your commission and your community. Thank you.
Yes, thank you, Councilwoman. And just thank you for all of these and listening to the community.
Thank you.
That's the first thing the commission wants you all to know is we do feel heard.
And I'm
we-
so sorry to interrupt. If you could, for the record, state your name.
Oh, yeah. My name is Tika Torres. I use he, him pronouns. I'm the chair of the city's commission. I work at Planned Parenthood of Maryland for my profession. So yeah, the commission is very grateful to hear and to hear, to have a voice and be able to be heard. Secondly, Dr. Bryant has been great since she started, really helping us to communicate more. Again, it's first steps, so it's not like, hey, everything's fixed, but it's definitely a very good first step, and we do feel like we're seeing a lot of change in the office, so that feels great. With regards to housing, I wanted to make sure to answer and address Councilwoman Ramos. I think the biggest thing is just a confusion, because sometimes we can be biased, obviously, without knowing about it. But I would invite you all to think, like, critically, right? I am a trans man. Where would you house me if I needed housing services? I think a lot of women might not feel comfortable being housed in a space with me. But then it's not appropriate, right, for me to be in a men's space either. So I think there's little things like that, right? I think sometimes we don't think about families and chosen families, and sometimes we don't want to be separated from families. But even my cis patients have this where, you know, they are homeless, but one of them can get a space, but not the other. They're not going to separate, right? So I think we don't think of families when we think of housing. We don't think of gender neutrality as far as the actual spaces. And bathrooms, we're working on them, but again, everybody has a gender neutral bathroom at home. It's not really a new concept, so it shouldn't be that easy to get it everywhere. As far as the commission itself, we've really been engaging with the Office of Equity and Civil Rights with regard to our legislative priorities and talking to them about our language, the things that really impact us, and they've been helping us with that. I guess the biggest question that we want to be engaged in is in all these conversations, right? We talked about guidelines for what gender affirming care looks like at our hospitals and healthcare systems, but where are those guidelines? They don't exist, right? We don't have that out there. Maybe Baltimore City needs to be the first city to do that. And we've been leaders in other things. We can do that here. Make it mandatory, right? We talked about providers not being able to provide primary care. Why not? It is simple. It is blood pressure. It is weight. It is, general health care. It has nothing to do with our gender as much as it has to do with other parts of our body. So why are providers allowed to opt out? I think that should be a big question, especially health centers like Hopkins and University of Maryland. Nobody should be able to opt out of caring for us, but it does happen, and it happens often. Mental health needs in the housing space. A lot of LGBTQ people have mental health issues that we're dealing with. A lot of us are dealing with family dynamics that aren't working, work is issues for some, with regards to getting access to public services. Again, we sometimes won't want to be identified. My documents have a different gender than what I express, and I was scared to travel for my holidays this holiday. So I think, and I am a U.S. citizen, a child of immigrants, but I think that's important to discuss, goodness. And the BPD, I want to just give them a shout out. They have been engaging with us, their community liaison. We're really looking forward to what their advisory board looks like and how that board and our commission can work together on expanding the things that we're seeing in the community. Our first steps are looking great. We really appreciate your support, and we're excited to see the city grow and continue. So thank you.
Thank you so much, Mr. Chair. And I just want to formally provide you all with the charge. One of the major, and this is something that just philosophically I believe in, community-centered policy and legislative agendas. I believe that you all can tell us what to do. And so we're really going to be relying on you all for your legislative agenda, your directions, working with Dr. Bryan to really guide the city council, particularly this committee. One of the other areas of training that I want you all to lean into is not only just training, but I'm talking about technical assistance, which is very different. And so there are so many brilliant minds within this communities, and I want you all to really lean into that, to direct some of those training and technical assistance focused on how we can change some of those guidelines within the city, provide that accountability for us, and also allow the opportunity for us not to have to think. We want you all to be very upfront with us in how you want to design not only just policy but the city as well. Last but certainly not least, when we're talking about any type of discrimination, this question is for the OECR. Is there any type of specific LGBTQ docket or group to handle a lot of these issues? Because I would assume, and correct me if I'm wrong, I would assume that it would have there are many issues that are going undocumented, and I want to make sure that we have a carved out way for these issues.
Yes, I am Chief Burton with the Office of Equity and Civil Rights Community Relations Commission, and they would come through intake like all of the other protected classes, and then they would have to meet the prima facie of a case for it to be opened up for a complaint.
And what's the prima facie again?
It would be based on what they're saying that they were discriminated for.
And what's the timeline? So
They
I know
still have, we're trying to
the
get it
300
changed, but they
days?
still have 180 days.
180 days, okay.
From the last date of the discrimination. And if it goes past 180 days, they have 300 days to file with the EEOC.
Okay.
Who of which, most likely, because we're partnered with them, they would then in turn transfer it back to the Community Relations Commission, and we would conduct the investigation.
Sure. The last question that I want to have, and Mr. Schneller is out of the room right now, but I'll ask it for the record. When I am looking at economic mobility and vitality of communities, I really believe that we need to have some sort of economic assessment of LGBTQ businesses or organizations within the city of Baltimore. There is an opportunity for marginalized populations to really collectively be together economically, and I feel like we need to be able to have that interest in the city, particularly with this vulnerable community. One of the major issues that I bring that up is because if people are not consuming with you, if they're not allowing you to consume their stores, you need to build your own stores. And so we need to have those types of opportunities for folks, particularly in the city of Baltimore. All right, any other questions? Colleagues, we're going to do one more round of testimony. Councilwoman Ramos?
I guess I'll wait for the mayor's office because I had a question about, one of the things that the chair brought up was about identity, and we have put some money in the budget this year for municipal ID. And I just want to know where that is. And so I hope that when the mayor's office gets back in, we can get an answer to that question, because one of the reasons we put, the mayor, when he was a councilman, passed legislation in 2016 to have municipal ID. It is still to this day not implemented. And we fought hard a past term to have money in the budget to be able to implement it. It got batted around between the Office of Children and Family Success and BSIT. I believe it's at BSIT now, so I'm just curious kind of where municipal ID implementation is.
Yes, and there's actually going to be I think it was yesterday, maybe today, I have to follow up with you. There's a town hall that BSIT was hosting, and that was one of the items to provide an update to community on where we are with the municipal ID program. So I'll be able to follow up with you on that.
Make that a committee request so that the committee formally gets that update as well. This is obviously an interest of the council that we've had for a while. Thank you.
Sure. So we're now going to do another round of public testimony. There were a few people. So for all that do not know, we usually do public testimony at the beginning because we center communities, and so we don't want to have you sit through the entire presentation without testifying. So I'm going to go back to Keith Holt from Begin Anew. You have 2 minutes, sir. And if you could press the button, and if you could introduce yourself. Thank you.
Is this the right button? Okay, I think I got it. Hello, hello committee, hello Chair Porter, honorable members of City Council, agency heads. My name is Keith Holt, and I am representing Begin Anew. Just a little bit about myself. I'm often cited in many national publications as a leading voice for my community, and I provided consultants for the National Smithsonian, as well as Peabody, et cetera. Over the last couple years, I have consulted for Begin Anew, which is a 501c3 that has reached thousands of Baltimoreans, including many gay and bisexual men. Now, before I dive into the data, I will also share that many research may not show Black gay men as we are grossly underrepresented in national surveys, and many SGL Black men not feeling comfortable with disclosing their sexual orientation to strangers, and this is from research from North Carolina State University. In Baltimore, 1 of every 24 Black men is living with HIV. HIV prevalence among men who have sex with men reaches 37%, one of the highest rates in America. A Black gay man has a 1 in 3 risk of acquiring HIV. Black gay men are 6 times more likely to die from HIV-related complications than other gay men of different races. Violence is also accelerating. Let's just say sexual orientation motivated hate crimes in Maryland. That jumped from 12 in 2021 to 49 in 2023. That's a 308 increase in just 2 years. Now, wait a minute, here comes the juice. Only 1 in 31 hate crimes are actually reported. In Maryland, about 40% of LGBTQ young people, including gay and bisexual boys and young men, seriously consider suicide, and nearly 40% who wanted mental health could not find it, and that's from the Trayvon Project. In 2024, Black residents made up about 65% of all overdose deaths in Baltimore.
Hold on 1 second. As a current elected official, I'll allow it. Keep going.
Okay. In Baltimore, with Black men, says the Baltimore Beat. This hits hard for me as I lost 2 uncles, and also being a legend in the ballroom community, I lost dozens of chosen family members. Begin Anew is a trusted resource for SGL men, yet we only have 1 grant from the Baltimore City Health Department, and I love Adina, thank you so much, and I love Christine, thank you so much. But we also need to remember that it's just the tip of the iceberg. We also, underneath that iceberg, we have mental health, education, housing, employment, addiction, and so many other drivers. Washington is abandoning us, so I ask Baltimore not to do the same. I am asking for increased funding lines for gay men health concerns, expanded housing resources, workforce development partnerships, liaisons for the offices of MOED, health, and other city agencies, mandated cultural competent mental health trainings, and support, not lip service, for organizations like Begin Anew, who is doing the work with boots on the ground. Show us in Baltimore that you see us, you believe in us, and that you are willing to invest in us and those we trust, like Begin Anew. Again, thank you so much, Councilwoman, for all your support. We greatly appreciate it.
Thank you so much, Mr. Holt. All right, next we have Ms. London Smith. And welcome back to the chamber, ma'am. There you go. Nope. There you go.
Okay. First of all, I'm honored to witness the leadership of my successor, Dr. Bryant, whose transformative approach I deeply believe will advance our shared goals for Baltimore. It has been a privilege to meet her, and I'm confident in her vision and her strategic leadership. Today, I come before City Council specifically to discuss LGBTQ students face a higher risk of bullying, mental health challenges, more so than their heterosexual peers, and with confident portions reporting chronic harassment in schools. LGBTQ youth experience higher rates of housing instability, homelessness, and underscoring their need for safe, affirming education pathways. Therefore, I come before City Council to seek endorsement, partnership, and sustained support as I work post-tenure to establish an LGBTQ affirming charter school in Baltimore. I've already engaged with Baltimore City Public Schools Board in anticipation of these evolving federal climates and these policy directions, including the recent actions to remove DEI. As a member of the auxiliary ballroom community, I have witnessed firsthand how safe spaces can become lifelines for youth who face bullying, discrimination, and gaps in family support. To many people that have seen their dreams constrained by exclusion. Yet we know that supportive, affirming schooling can change lives. I envision a safe space model that includes a potential housing option for unhoused or foster system youth, offering an alternative to traditional pathways while aligning with evidence-based curricula and supports. This model would prioritize the well-being, identity, and academic success of LGBTQ students, including athletes who deserve inclusive spaces to compete, free from undue focus on anatomy, instead guided by skill, character, and teamwork. By grounding our approach in research and best practices, we can create an environment where all students, especially LGBTQ youth, can thrive. I welcome partnership with City Council and the Baltimore City Public School Systems, community organizations, and families to make this vision a reality. Thank you.
Thank you so much, Ms. Smith. Mr. Chair, that may be an opportunity for collaboration as well. Okay, thank you. All right, before we conclude today's hearing, any other questions, colleagues?
Madam Chair? Thank you. I do have a question for MOHS.
I'm representing them today.
Okay. In our last hearing, we weren't able to get to this issue of the fact that the federal government is about to cut a lot of money for permanent supportive housing. And not just for the LGBTQ community, but for all of our communities that utilize. That's 700 units that are going to be impacted.
Yeah.
So can you talk a little bit about what our plan is?
Yeah, I'll follow up with you.
All right, I'll make that a committee request as well.
Thank you. If you can repeat that
Sure.
for Marguerite.
There is, the federal government is cutting funding for permanent supportive housing.
Yes.
It's going to impact about 700 units of
And-
permanent supportive.
Yes, and the official committee request, ma'am?
Is for a plan for how we're going to be able to support, well, twofold, advocate that that doesn't happen, and two, what the backup plan is in case it does.
Great. You got that, Marguerite?
Yes.
All
Thank
right.
you.
Thank you so much. All right. In closing, I just want to underscore that this conversation is going to be ever going. This is something that I am personally interested in. I have friends and family within this community that it scares me of where we are in today's climate. And so it is incumbent upon the leadership of myself and this committee to make sure that we not only prioritize the health, safety, and wellness of all people in Baltimore, not only just within our city agencies, but also with our influence as well. And so I look forward to working with Dr. Bryant, Dr. Taylor, to use the influence and the brilliance of this committee to make a vision a reality. Thank you so much, everyone. Bye-bye.